Hi there, you're welcome to Demi RX Care channel where we talk about medications and how to use them properly. So today our medication of topic is Pristiq. So Pristiq is also known as DESVENLAFLAXINE, and it's a common antidepressant that's used in our patients, like I said, for depression as well as for flushing symptoms in patients who have menopause. So this medication dosing kind of varies depending on what you're treating. So patients that are using it for depression most likely start with 50 milligram daily, and then they move up to 400 milligram as time goes on, depending on how well the medication is working and if the doctor would like to increase that so they can get the maximum effect that they're looking for with this medication. Also, for patients who are using it for flushing symptoms for menopause, patients are usually on a 100 milligram tablet by mouth daily. And so what are some side effects of this medication? So one of the side effects is nausea, dry mouth, constipation. It can make patient also dizzy and drowsy. So you want to make sure that when you're using this medication, you're not operating any machinery that requires you to be mentally alert, as well as sweating as well, and also decreased libido and erectile dysfunction in men. So make sure that you're aware of those side effects. And if it's very unfavorable to you, you can always have your doctor switch it to another antidepressant. All right, so what are some severe side effects that you want to look out for while you're on this medication? So a severe side effect will be suicidal thoughts. This can be very common and severe in patients who are using it as an antidepressant. And once you start seeing these changes in your mood and you're having more suicidal thoughts or action, then you want to call your doctor's attention to it to see if they will have to take you off this medication, or they will have to place you on another therapy or increase the medication to make sure that there's a balance in those chemicals that are causing this, behavioral changes. So what should you know while you're taking this medication? So make sure when you're taking this medication, you can take it with or without food. Make sure you're taking that with a glass of water. Also, you also don't want to make sure that you're crushing the tablet. You don't want to crush a tablet because it's an extended release tablet that's supposed to be released slowly into your bloodstream. So crushing the tablet will increase the exposure that you're getting to that medication the way that we don't want it to be exposed into your bloodstream. So making sure that you're taking it and not crushing or chewing the tablet is a great thing that you want to make sure that you're doing while you're on this medication. Also, patients who are taking the capsule, you might notice like a matrix shell in your stool. This doesn't mean that the medication isn't working. It's just that the matrix tablet doesn't get broken down or digested in your stomach. So that way it's getting released into your stool, and that's why you're seeing it in your stool. So it doesn't mean that the medication is not working. So don't be alarmed. All right. And also, when do you want to start seeing some noticeable improvement in this medication? So patients usually don't see a noticeable improvement until after about 2 to 4 weeks. So you want to make sure you give the medication time to work before switching it over or discontinuing the medication. That way it's able to help ramp up those chemicals such as serotonin or norepinephrine that your body kind of needs in order to help boost that mood or in order to help balance out your mood all throughout the day. All right, so gradual reduction of this medication is recommended if you are going to stop the medication. It's recommended that you stop it and reduce those tablets slowly, making sure you're talking to your doctor as well before stopping the medication so they can help you in the titration of this medication to a lower dose before you're done, before you discontinue the medication totally, in order to avoid any withdrawal effect that might occur from discontinuing this medication abruptly. All right, so what are some medications that you want to look out for that may interact with DESVENLAFLAXINE or Pristiq? So these medications are known as MAOI medications, such as phenelzine, isocarboxacid. They're also selegiline and triacylopramine that you don't want to take with these medication. So if you are going to switch over to the medication that I listed earlier, make sure that you stop the DESVENLAFLAXINE or Pristiq for 14 days before starting those medication in order to avoid something they call serotonin syndrome in patients. All right. Also, some patients have noticed that their blood pressure are elevated while they're on this medication. So make sure that you are discussing that with your doctor to make sure that they can either taper you off of the medication or see how they can help you with another medication that you can use that's not going to cause this hypertensive effect. Another thing that you want to make sure you're doing while you're on this medication is avoiding alcohol. Like I said, the medication can cause drowsiness and dizziness. So alcohol is most likely going to potentiate that effect and increase your risk for drowsiness and dizziness, which we don't want. All right, I hope this video was informative for you in terms of what to look out for while you're on this medication. Thank you, and make sure you check out our make sure you hit the like and subscribe button. That way you can help support our community here at DESVENLAFLAXINE. Thank you and stay blessed.